third rail of American politics is at risk of being touched. MAGA Republicans are moving forward with Donald Trump's so-called Big Beautiful Bill, and it includes indirect cuts to Medicaid. That's something that Republicans called everyone hysterical for suggesting was on the table, and something that Trump himself vowed never to touch.
Save Medicare, Medicaid, and Social Security without cuts.
We're not cutting Medicaid, we're not cutting Medicare, and we're not cutting Social Security.
Can you guarantee that Medicare, Medicaid, Social Security will not be touched?
Yeah, I mean, I have said it so many times, you shouldn't be asking me that question. We're not going to touch it. Now, we are going to look for fraud. We're going to love and cherish Social Security, Medicare, Medicaid. We're not going to do anything with that. Medicare, Medicaid. None of that stuff is going to be touched.
What the bill would do is enforce work requirements for Medicaid and increase eligibility checks. Experts say those two actions alone would take away coverage for millions. And it's not just the liberals who are sounding the alarm. This is interesting. It's actually some of the most conservative Republicans.
It is wrong to cut health care for the working poor. My state is a Medicaid expansion state. Over 20% of Missourians, including hundreds of thousands of children, are on Medicaid. And they're not on Medicaid because they want to be. They're on Medicaid because they cannot afford health insurance in the private market. This whole idea of we're going to charge them now additional copays in order to access health care, I have to say that this sounds like a tax to me. So now we're taxing poor people when they're trying to get access to health care? It's reverse class warfare is what it is. It's taxing the poor to give to the rich.
John Prideaux, a U.S. editor at The Economist, is with us now at the table in our fifth seat. It is so fascinating. I mean, he has been very consistent over the last few weeks in raising the alarm about this. And he's right. About 44% of all the people enrolled in Medicaid are living in congressional districts that are represented by Republicans. It's 36.8 million people. Millions will be affected by this, no question about it. And it's also something that I'm not sure. I mean, I think you've done some reporting on this. They're going to get the results that they're hoping for. Force people to work, or say you're going to force people to work, kick them off the program. Will it produce more jobs for people?
Right, Abby. So Senator Hawley is part of this faction of the Republican Party that wants the party to be a more working class party. And so that's why you get the criticism from there. And the theory here is that the GOP can save some money in the gigantic budget bill. There are a lot of spending items in there, and they want to claw some revenue back. They can save some money by adding work requirements to Medicaid. And I think there's a view out there in the country that maybe a lot of people are not working and getting Medicaid, and that's not popular. Actually, that's not really true. About 70 million Americans are covered by Medicaid. And according to the CBO, at least, by 2034, this bill would take health insurance away from 8 million people. So you can see from the math there that maybe 10% of the people currently covered by Medicaid are working age adults who are not in work. So the amount of money saved by adding work requirements is actually relatively small. And that's the theory, but then in practice, there's a kind of real world experiment, because the state of Arkansas put work requirements on Medicaid a couple of years ago, did this experiment. And what they found actually is the employment rate didn't go up much, but quite a few people lost their health care.
Yeah, I mean, Batya, you're working class people. I mean, is Josh Hawley right that this is not the bargain that they voted for when they put Trump into the White House?
I'm 100% with Hawley on this. I think that they should be leaving this stuff alone and raising taxes on the rich. I think that's totally consistent with what the president promised the American people. It's why people voted for him, to represent working class people, and it's unbelievably popular. And Trump likes popular things. So I think Hawley is 100% correct on this, and he's the future of the Republican Party. This is a working class party at this point, and he knows it. How?
Well, I don't think the American people voted for Trump to raise taxes. So we all know there's a spending problem. That's the problem. And it's Medicaid, Medicare, and obviously Social Security are the big outlays. It's close to $1 trillion in Medicaid, about $900 billion, I think, right now, for about 72 million people, as was just said. It really shows the failure of Obamacare. And Obamacare is so expensive. A family has to pay about $24,000 to be covered under Obamacare. You can't afford it. So all this thing about Obama is going to solve the healthcare problem. Everybody's moved over to Medicaid. It's moving towards socialized medicine for the entire country. That's the problem, and that's what they're trying to figure out how to fix. When you have working age males that are on Medicaid, that's a real problem when you have 4% unemployment. So we have a pretty full employment economy, Wages are not as high as they need to be. A lot of that has to do with immigration problems and outsourcing of jobs. So there's a whole gamut of issues around this. But when you have that many people that can work and pay, there needs to be something that needs to be done on the healthcare cost side of things, and that's a really hard problem to
So
tackle.
you kick people off Medicaid first, and then you figure out the rest later. I mean, I think that's the issue: is that you kick them off, and then what?
Well, I don't
I
think
mean,
that's
this is
what
about.
they're
I
saying.
just want to remind people we're talking about healthcare here.
Yeah.
So access to medical care for people. A lot of them are children. A lot of them are elderly. Most of all of them are poor virtually. So what then? I mean, you're saying basically to fix the affordability problem, you have to fix the healthcare problem. There's no attempt to do that. I just don't see how this
Well,
works out.
it wasn't about kicking people off. It's, as you said, it was about creating some work requirements that people can't just sit around working age, fully able people and just collect Medicaid and benefits. I mean, we've got to get off of that, medicine that's been out there for a long time.
What about the job seekers? What about the people who are looking for work? And as you mentioned, we're in a near full employment economy right now. Wisconsin has had historically high employment for the last several years now. So there are people who still are in need of healthcare but cannot find a job. The unfortunate reality is that with healthcare being tied to a person's employment, when you lose that job, you've lost your health care.
Yeah.
What else can you rely on?
The whole system's broken.
Well, the whole system. And I have been a long proponent of universal health care system, which would solve all of our problems, to be quite honest. And I don't know a whole bunch of arguments against it. If you look at the amount of money that people would be saving, consumers, that would ultimately be bankrolled by raising taxes on the wealthy, as you mentioned. Thank you for that point. And what Josh Hawley also has advocated for.
Well, raising taxes on the wealthy isn't going to pay for any of this type of thing. I mean, there's just not enough wealthy people to pay for everything.
I
So,
guess what Holly is also suggesting, and you can jump in on this, I mean, is essentially that Republicans want to give a lot of tax giveaways in this bill. Some of them are new, some of them are existing tax law. And they want to do that by paying for it, by cutting benefits for poor people. That's how he laid it out. Okay. I don't see how if you're one of those poor people and you work really hard at a McDonald's and they're not providing health insurance and you have nowhere else to turn, you're paying your taxes. How do you not see this as sort of, robbing Peter to pay Paul, essentially?
I've heard these complaints about Obamacare now from Republicans since Obamacare passed. And you have the opportunity to get rid of Obamacare and replace it with something else. And all I've heard about is, repeal and replace, repeal and replace. You haven't repealed it because you have nothing to replace it with. So let's start with that premise. Second, you're absolutely right. What this is attempting to do is to take away healthcare from millions upon millions of Americans. And then you're going to say, well, we'll figure it out later. Because that's effectively what you're suggesting. You're blaming this on Obamacare. You're blaming this on a whole host of issues that you're in charge of everything now. You're in charge of the executive branch. You're in charge of not just 100 days. You were in charge under Donald Trump, right? The first time around. What did you do? You couldn't do it. You didn't do it because you're not.
60 votes. I mean, John McCain voted against it.
You know what? You could want to blame John McCain all you want, but the reality is you could have gotten rid of it, but you had no plan to replace it with. And all of those people would have been thrown off of Obamacare, including Josh Hawley's state, which expanded Medicaid under Obamacare. So you can talk about it all you want. Where's your plan? You don't have a plan.
So John, let me ask you this. What happens, because this is a problem for Republicans right now, just among Republicans. People are not happy that they're not cutting enough spending. Some people are unhappy that they're dipping into Medicaid. Some people are unhappy about a bunch of other things, salt, state and local taxes. If they increase spending by like $4 trillion and only cut it by like $1, what do you think is going to happen as a result of that?
As you say, the projection is, a $4 trillion increase in spending. At some point, the US government's ability to just carry on spending more than it brings in revenue and financing that difference through raising debt, at some point, you run into trouble with that. Now, no economist can say when that will be, but if you look at the debt to GDP ratio, it's increased a lot over the past 10 years. And, that's not a great way to run your economy. I mean, the deficit already is, I think, 6.9% of GDP at a time when the economy has been growing pretty strongly. Ideally, when things are good, you want to balance your budget and then save your firepower for when there's a pandemic or a global financial crisis or something you really need to borrow.
I think we're also in a world in which
this
I'm
is a
not
two-party
sure.
problem.
Republicans used to talk about this a lot. They don't really much when Trump is in office, in particular. So I think it's also worth noting that it is likely that
Right,
that is
and
going
that's
to be the
one of
outcome
Donald
this.
Trump's political innovations, which I think is a big reason why he's been elected president twice, was that he kind of gave up on the entitlement reform part of the GOP platform, right? If you go back to 2012 in that election, Mitt Romney and Paul Ryan got absolutely killed for suggesting that America needed to cut entitlements in a big way. And Donald Trump's kind of given up on all that stuff. And that has allowed the GOP in part to appeal to more working class voters. And you can just about make it work in the good times, but at some point the bill will come due.
Yeah, it certainly will at some point. Coming up next for us,